Hi, my name is Dr. Nicole Hetzer. I'm a general pediatrician at UCLA Porter Ranch. I'm here today to talk about children's oral health. This topic is important to me, especially. My dad is a dentist, so I grew up in a house where dental health was really important. And now as a general pediatrician, I also think it's really an essential component to overall well-being in your child's health. So let's get started. If you have questions, you can ask them using the hashtag UCLAMDChat, or you can post them on Facebook. So let's start first with a few important terms, the first of which is dental caries. This actually refers to the disease process that leads to dental cavities. A dental cavity is the actual hole that you find in the tooth surface. And when you hear the term dental decay or tooth decay, that can talk about either dental caries or dental cavities. To set the stage, let's look a little bit about how common tooth decay is in the United States. So it's actually the most common chronic childhood disease, which is pretty surprising. It's 5 times more common than asthma, which is something that we hear about all the time. Looking at the numbers, over a quarter of children 2 to 5 years old have some form of tooth decay, and over half of older children 6 to 11 have some form of decay. 51 million school hours are lost every year in the United States just due to tooth problems, toothaches, having to go to the dentist, etc. So really to target this, we have to look at methods for early prevention and education. So that's what I'm hoping to get to with this topic today. So first we'll look at the structure of the tooth to understand a little bit better why a cavity and how it forms. So starting here, this is the outer layer of the tooth, which is called the enamel. You can see this is pretty thick, and this is the portion that we see when we look into the mouth. This is really full of minerals, and it's quite hard. As you get decay that wears down on the enamel, it can go down into the dentin, which is the next layer of the tooth. Underlying the dentin is the pulp, and this has, you can see, the nerves and the blood vessels that feed the tooth. So again, when you get the decay that goes through the enamel, it takes some time because it's quite hard. Once it gets to the dentin, it moves much more quickly, and then it balloons out into this big lesion that we call a cavity. This is taking a look at what we call early childhood caries, or ECC. This is defined as any tooth decay in a child less than 5 years old. And really this is a spectrum of disease. So you can see we're starting here with mild ECC, which to the naked eye you might not really notice. It's seen as just some small white spots on the tooth. And what's unfortunate about not noticing this is this is the stage where it's actually reversible, and if we do some treatments and some prevention, it can be fixed. However, if it's let to progress, you can see we move on now and we're getting some discoloration to the tooth and some wearing away of some of the surfaces of the tooth as well. If left unchecked, now you're going to move to severe ECC, which you're now seeing marked discoloration and really a lot of loss of the tooth surface. I put over here, lift the lip to look for decay. It's a reminder for all our providers that we really should be looking under the lip at those front teeth. The top 2 front teeth are at most risk of decay, and that's because they don't have as much salivary flow. And we'll talk about this later, but saliva is actually protective and helps to wash away bacteria from the surface of the teeth. ECC is actually correlated really strongly with a few factors, which I put up here. So lower socioeconomic status, poor access to dental care, parents that don't have great dental health, and then our children with complex medical needs are all at higher risk. I hear parents come in when they come to their visits and say, well, but they're just baby teeth, why is it important? But baby teeth or primary teeth actually have a lot of really important roles. The first of which is that, eating and nutrition. I'm counseling parents all the time about nutrition in their children, and you can't expect your child to eat if they have painful teeth or missing teeth. They're also really important for holding space for permanent teeth. So orthodontic issues can arise if you're losing your baby teeth earlier than you should. They're also very important for proper speech development, making certain consonants. It's essential to have teeth there. As well as building habits for lifelong dental hygiene. So as a pediatrician, a lot of what I do is preventative care and building habits for the rest of your life. So you can't expect a child who never learned how to take care of their teeth to turn into an adult that respects and cares about dental hygiene. And finally, smiling and confidence. Young kids are just learning. They're out in the world. They're in the social situation where smile's the first thing you see. And so we really want to give them the best chance that they can to have that confidence. Looking at what causes dental caries, I've put up a triad here. So there's three main factors. There's bacteria that lie in the mouth that metabolize the sugars in what we eat to then produce an acid which can destroy the top of our teeth. And we'll look at each of these factors in more detail to look at how this happens. The first is oral bacteria. So our mouth is full of bacteria. The most common one that plays a role in the cause of cavities is called Streptococci mutans, or strep mutans for short. And this is a picture of it here. And what this bacteria does is it forms a biofilm, which is a bunch of the bacteria along with the sugar from our diets, and it's a sticky film that adheres to the teeth. And that's why you really have to work with brushing to make sure that we get all those films away. Now, how do we get this bacteria? Not all babies are born with this in their mouth. We think that it's actually passed on from the primary caregivers. So babies can actually become colonized in young infants even before they have teeth. The bacteria can live in the sides of the cheek and around on the tongue. And then when teeth come in, it can affect the teeth. It has been shown that caregivers that have a higher level of oral bacteria in their own mouth are at much higher risk of passing this bacteria on to their children earlier. Looking a little bit at sugars. So the bacteria feed on the carbohydrates in our diet. And there's different forms of carbohydrates, but what they do is they break them down into smaller building blocks and simple sugars. They can use each of these different types of sugars differently. The one that they can get the easiest and most energy from is sucrose, which is found in some of our favorite things like candy, soda, simple white refined sugar. But it also is found in things like fruit. So fructose can be broken down into material that the bacteria can use to produce acid. And one we don't think about a lot, but milk, so cow's milk, formula, even breast milk have components that can be broken down into these simple sugars and used by the bacteria for metabolism. Even more important, though, than the amount of sugar that you're consuming is the frequency with which you're consuming the sugar. So I've put up here a graph of a couple different patterns of eating. To explain this, on the y-axis here, we have the pH. At a higher pH, you're in a more neutral to basic zone. Down here in the danger zone, the lower pH is an acidic pH. We want to lie somewhere around this or above this red line. So let's take this first child. They start off the day in the safe zone. They're going to get up and they're going to have a sippy cup full of milk. They dive down into this danger zone with the sugars on the tooth that the bacteria are metabolizing, and it takes about 20 to 40 minutes for the saliva to effectively wash away the acid and that the bacteria has produced from the teeth. After those 20 to 40 minutes, they pop back up. But now this kid's going to go on to have breakfast, pancakes and syrup, dropping back down. And then you'll see that throughout the day, they're going to continue to snack, drink from their sippy cup with milk, and they're never really giving themselves adequate time to get back up into this safe zone. Contrast that with a child who gets up in the morning, they have their cup of milk and their breakfast together, so they dip down here, then the saliva washes away all that acid, and now for the rest of the morning they're drinking a sippy cup with water only. They're staying up here in this safe zone and dipping down again back for lunch. But you can see that overall the amount of time you're spending with these more frequent snacks in this acidic zone is much increased. So what can we do to help prevent dental caries? Again, we're going to target each of the factors of the triad. So we're going to look at how can we delay the colonization of bacteria with strep mutans? How can we limit the amount of times that sugar is being introduced into the mouth? And then how can we protect our teeth, especially using fluoride to make them more resistant? So first we'll look at delaying oral bacteria transmission. So I emphasized this before, but regular dental care for not only pregnant women, but other caretakers as well, everybody who's going to be involved in the life of this child is really important. Again, good just dental habits for everyone. Limit your sugar intake, practice good oral hygiene, using toothpaste with fluoride. Those are all important things for everyone. And it also can delay or decrease the amount of bacteria you have in your mouth and delay that transmission to your child. One additional thing not everyone knows about is chewing xylitol gum. So xylitol is actually a component that the bacteria try to ingest, and instead of giving them energy, it actually takes more energy for them to try and digest the xylitol, and so it kind of stagnates the bacteria and they aren't able to flourish off of it. And they've done several studies where they had mothers who were pregnant or had young infants that chewed gum every day, and then they looked at the rates at which their children acquired the strep mutans. And they had some really surprising results. So in the women that did chew the gum, only 10% of their 2-year-olds were colonized by strep mutans, where 49% of the baseline of women who didn't chew xylitol gum, their children were colonized at 2 years old. The numbers when they were about 6 years old, 52% of the women, of the kids of the women who had chewed the xylitol gum were colonized, and 84% of those that hadn't chewed the gum were. So you can see there's definitely some impact there. And they also showed, besides colonization with bacteria, that actually the rates of dental caries were reduced by 70%, which is a huge number. Tips for infants. So we really do encourage breastfeeding. Breastfeeding has a lot of protective effects, and we do encourage that. If you're going to bottle feed your baby, we discourage against bottle propping, which is leaving your infant with the bottle propped so that you don't have to hold it. Again, what that does is it leaves the infant with the pooling of the formula sitting there in their mouth and more sugar for the bacteria to attack. You really should only be putting breast milk or formula in a bottle. We discourage putting juice in bottles because this is really high sugar content. And then again, one of the most important things is avoiding the bedtime bottle habit. So most children like to have a bottle before bedtime. Really crucial to wipe their teeth off afterwards. There are a lot of kids who fall asleep with a bottle in their mouth. So why is this bad? Because children's saliva flow decreases during the nighttime, and that's that protective effect that washes away the bacteria. So they're left with this pooling of the sugary substance and then little saliva to wash it away. So a much higher risk for formation of those cavities. What can you do instead? Clean pacifier is an alternative. Just reading or singing to your child, or thinking about a transitional sleep object, which would be something like a stuffed animal or a blanket. We do encourage those for only children that are over 1 year of age, as you shouldn't put any large stuffed animals or large blankets in a crib with a child under 1 year of age for risk for suffocation. Tips for older kids. So like I mentioned before, the child who had the sippy cup with water, we really encourage that. Avoiding letting your kid carry around a bottle with milk or especially juice throughout the day so they can take frequent sips from it. Avoiding juice altogether is actually a good thing. It's really high calorie, little nutritional value. We'd rather your child eat the whole fruit and get more fiber that way. And then if you do choose to give your child juice on occasion, you could think about diluting it 1-to-1 with some water. And then really try to limit grazing and snacking, which we know is hard in kids because that's how a lot of them eat, but trying to be regimented about 3 meals and 2 snacks a day. Now let's look a little bit at the protective effects of fluoride. So how can we make our teeth more resistant to this bacteria and acid production? So there's 2 ways we can get fluoride. One is topical. Topical fluoride is found in things like mouthwashes, toothpaste, fluoride varnishes, and that works directly on the outside of the tooth to help promote remineralization. Systemic fluoride is fluoride that we get from ingesting it, so from water in our diet or from fluoride supplements. And this works kind of on the inside in developing teeth to help make the enamel more strong. So fluoride itself, it's actually found in nature. It is something that we now add to our water supply, and it's actually been a really great public health feat for our country. We've decreased our rates of cavities markedly. The key with fluoride is really getting the right amount. Too little, you're at risk for cavities, and too much, you can be at risk for something called fluorosis. Now, fluorosis is a cosmetic problem only. It shows up as white spots on teeth, and it usually occurs in children who get a lot or too much fluoride when their teeth are developing in the gums. Again, this is a cosmetic issue only. It's not going to affect the structure of the enamel. How much fluoride is in my water? I've had a few patients ask me this, so you actually can find out. There's a website, I've put it on the bottom here, where you can look up by your zip code and your water supplier to see how much fluoride you have. In general, in Los Angeles County, we all have around the recommended amount, which is 0.7 milligrams per liter of fluoride in the water. But you can look this up specifically. And I always recommend that if you do have specific questions, you ask your doctor or your dentist to help you think about if your child needs a fluoride supplement or not. Again, in general, in this county, we're pretty well fluoridated. You probably do not. But if you do have questions, you can always ask your healthcare provider. Just to give you an idea of when we decide to supplement. So in general, in the smallest of children under 6 months old, we usually don't recommend the supplement. But as they get older, if you have water that's inadequately fluoridated, then we do recommend small amounts of fluoride supplements. So how can you get the right amount of fluoride? Breastfeed your baby. We recommend that for multiple reasons, but it's also good for getting the proper amount of fluoride and for preventing cavities. You can introduce fluoridated water after your child is 6 months old. I usually tell my parents to start with a conservative amount, around 4 to 6 ounces of water, and you can increase that as your child gets older. Breast milk and ready-made infant formula do contain a small amount of fluoride. Powdered infant formula does as well. So if you're adding a fluoridated water source to your powdered infant formula, you may run a small risk of fluorosis. But again, this does not affect the health of the teeth themselves. If you're overly concerned about the amount of fluoride, you could consider using a distilled water when you add it to your powdered formula. Talking a little bit about toothpaste. So most of the children's toothpaste that you find on the market don't actually have fluoride added in it. But we now recommend that all children, as soon as they have a tooth, use toothpaste with fluoride. So you have to be careful and look on the actual tube of toothpaste to see if it has fluoride in it. Now, the way we're going to control how much fluoride they get is by using a very small amount of toothpaste, and we'll talk about that in a little while. We expect that they're going to swallow it, and that's why we would put a very small amount. And again, that'll just contribute to a little additional fluoride that they'll get in their diet. Fluoride varnish is another great thing that you can start with the appearance of teeth. And what fluoride varnish is this sticky substance that either the dentist or your pediatrician can paint on your children's teeth. It gets painted on, and then afterwards they can go eat and drink as they want. And it has its action, it's working on the tooth, and eventually it'll kind of wash away. We recommend this every 3 to 6 months, depending on the risk of your child for early childhood caries. Those at higher risk would be recommended every 3 months. Those at regular standard risk would be every 6 months. So definitely ask your provider about this. Here is what I was talking about the amount of toothpaste. So it's a lot less than we see. You see the toothpaste commercials and you've got toothpaste across the entire tooth. So for children, we really should be using a very small amount. Children 2 years or less than 2 years, it should look like this, like a grain of rice, the smallest smear of toothpaste. And children 3 years or older, you can use a pea-sized amount. Now, when you're brushing, we want you to brush twice a day, but I always say the most critical is that bedtime toothbrushing. And that's because for that the lower saliva flow that's occurring at that time. Caregivers really should brush your child's teeth until they have the manual dexterity to either write their name in cursive or tie their shoes, which usually you're seeing around age 5 to 7. But younger children really should have the caregiver assisting with the toothbrushing. You can use a soft nylon brush, and then we talked about the amount of toothpaste, and making sure you're hitting every tooth surface. So really concentrating on each tooth surface that you see in the mouth, and including the tongue as well. We recommend not rinsing with water afterwards. The reason being you've just put some great fluoride onto those teeth, and we want to leave it to give its action for a little bit of time. I'm going to switch gears for a moment to talk a little bit about developmental issues with oral health. The first is teething, and we get asked about this all the time in the pediatrician's office. So baby teeth usually begin to appear around 6 months of age, but that's very variable. I've had several patients who didn't have a tooth by their first birthday who were just fine. More important than the timing of the first tooth is the sequence that they come in. Typically, we see the bottom 2 front teeth come in first, then the top 2 front, and then it goes back from there. With teething, you can get some fussiness and some sleep difficulty. This is definitely something parents face. You may have heard that it causes things like diarrhea or fevers or ear infections, but that's actually not the case. Those things are probably due to viral infections that your child has along with the teething. Drooling is normal at this developmental stage. It doesn't necessarily mean your child's going to get a tooth. I've had some parents who come in saying, oh, my child's been drooling for a month, where's the tooth? Again, it may not be correlated. We like to recommend using things like teething rings so you can cool them. There's some that you can put in the freezer, or even just a washcloth is a good thing for a child to chew on. I tend to avoid recommending the teething gels. Many of them have some anesthetics in them that when ingested can be possibly at dangerously high levels, so we really don't recommend those. You can consider giving a small amount of Tylenol or ibuprofen in children over 6 months of age. Talking a little bit about non-nutritive sucking, so sucking your thumb, sucking a pacifier, really, really common. Sucking is a normal baby reflex. It's something that they do as a soothing mechanism to help them in times of emotional stress. Babies can suck just about anything they can find, their fingers, your fingers, pacifier, etc. Most children tend to stop on their own around 2 to 4 years of age, but that's not always the case. Just a note on pacifiers, the AAP now does recognize that pacifiers has been shown as a protective factor against SIDS. So if in talking with the parents and your pediatrician, you decide that you'd like to try a pacifier, we do recommend you wait until breastfeeding is firmly established, usually around a month of age. And then it's used for aiding with sleep only. So you can give it to the baby when you're putting them to sleep. If it falls out, you should never replace it, and you should definitely never stick it in anything sugary like sugar water or juice, etc. Looking here, you can see the effects of a child who's been sucking their thumb for some time. So orthodontically, you can see that these teeth have been pushed up and forward in the jaw. So again, this is really a worry when we're talking about permanent teeth, so children that are continuing this habit after they have permanent teeth erupting. So what can we do? I think talking to your child is always important. You know, talk to your pediatrician. We'll talk about it during one of the visits. Explain why you want them to stop. We want your teeth to be healthy, etc. This age is a great age for reward systems. So, you know, if you don't do it for 7 days in a row, you get a coloring book or whatever is going to be an incentive that would be good for them. You can also encourage a different comfort object, so a blanket, a stuffed animal. And then if you want to, you can cover their hands with mittens or socks. I do this for children that are having issues with eczema as well. It discourages during the nighttime unintentional bringing the hand to the mouth. So in summary, we've talked a lot about early childhood caries. We talked about its prevalence, that it's really the most common chronic disease in kids in the United States. We talked a lot about how cavities form, so I hope you have a better understanding of how the bacteria consume the sugar from our diet and form acid that then penetrates down into the tooth to form a cavity or hole. And you know, we really can prevent this by practicing good habits and practicing them early. So that's what I hope you've gotten from this presentation. I think now we have a few questions. Thank you. So the first question is, what age should an infant start using toothpaste? And that's a great one. So it's actually as soon as a tooth comes in. So there's not any lower limit to the age that they can use toothpaste. As soon as there's a tooth there, you can go ahead and use that really rice grain size of toothpaste with fluoride on their teeth. Next question, can brushing after each bottle and snack help prevent decay? That's a great question. So, you know, it could, but we also don't want you to get into a point where you're having to brush your child's teeth after every single meal that they're having. That's why I try to strike a good balance with the morning brush and the evening brush and sticking to those 3 meals and 2 snacks. Because you did see that even without brushing, when we looked at that chart, we were able to come back up into the safety zone after the saliva washed it away from the teeth. And brushing too much could also cause a little bit of trauma to the teeth. So again, we want to be reasonable. I think I'd like to stick to the twice a day. Next question, my child hates brushing. How can I make it more fun? So this is a problem for a lot of people. They actually have a lot of great apps that are out now. A couple that I like are called Brush DJ or Star Teeth. Sesame Street even has a video. And each of those comes up with clips that are 2 minutes long that can encourage your kids to keep brushing for the full 2 minutes and makes it a little bit more fun. You could also think about having your child practice brushing on a stuffed animal or a little doll, or if you're braver and as a parent, you can have them try brushing your teeth while you brush their teeth. Another question, my child had a tooth knocked out, what should I do? So When a tooth is knocked out, the most important thing is to get it into a moist environment. We want it to be in something like milk is ideal if you have it available. If not, you could have your child spit into a cup, and that's actually, saliva is a good medium. As a third choice, water is also available and can be used. You want to take the tooth and handle it with the enamel of the tooth, so not touching the root, which is the portion of the tooth that's normally under the gum. Pick that up, put it in the liquid, and then get to your dentist as soon as you can. Hopefully they can implant the permanent tooth. If they can't, you can talk to your dentist about other options such as dental implants. And last question, are dental x-rays safe for my child? So often when you go to the dentist, they'll want to get an x-ray to take a look at the teeth and the structures that are down below the surface of the jaw. So the short answer is yes. The amount of radiation that you get from a dental x-ray is very, very small. We get tons more radiation just from flying across the country in an airplane, and we wouldn't think for a second about that as radiation risk. The information that the dentist gets from these films is really valuable, so I do recommend them. So I think that is all the questions. It's been a pleasure. I thank you guys for watching, and I hope to see you soon, either at my clinic or at a future webinar. Thank you.